Okay, I think we're ready.
Okay, good morning, everyone. We appreciate you joining us for the meeting this morning. Appreciate all the board members that are in with us and all the staff from Eastern Idaho Public Health. This has been a considerable effort to pull all this together each and every week, but we do appreciate Director Rakow and all of her staff and the work that they put in. I'll call this meeting to order for Thursday, September 10th of the Board of the Eastern Idaho Public Health. Our meeting is being streamed on the YouTube channel of East Idaho Public Health, where the public is able to view it. There is also a room set up at the building where they can accommodate any public that desires to show up at the meeting location and see the meeting at that place. We also have a portal set up on our website where any public is able to email comments to the board that we will consider throughout the week and then be able to address either individually or at our weekly board meeting. We'll begin with a roll call this morning. We'll start with our physician representative, Dr. Nelson.
Good morning, Dr. Barbara Nelson, present.
Thank you. Teton County.
Bill Lake, present.
Jefferson County.
Shane Young, present.
Madison County.
Brent Mendenhall, present.
Fremont County.
Lee Miller, present.
Lemhi County.
Ken Minor, present.
Clark County.
Present.
And Custer County, I understand, will not be on the line. Is that correct?
Yes, that's correct. And he's assigned his proxy to Commissioner Shenton.
Okay, thank you. And of course, I'm Brian Reed from Bonneville County. It appears that we have a quorum of board members. We're absent just one from Custer County, and Commissioner Shenton has his proxy today. So we'll go ahead and go right into our meeting. First, we need an approval of our minutes from last week, September 3rd. You can see them on the screen. They were also sent out and you can find them on our website. Are there any changes that need made to those, or if not, I'll take a motion to approve.
I move we approve the minutes from last week.
Thank you, Dr. Nelson.
I second.
Okay, a second from Commissioner Minor. All in favor, say aye.
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 All right, thank you. We'll move on to item 3 in our agenda, which is review of the public comments. There were very few comments received this week, and I believe that they were all addressed individually, either by email or phone call. Do any of the board members have any comments or anything they would like to add in regards to comments they received this week or were able to address?
I just, this is Commissioner Young, Chairman Reed. I did speak to one lady and she just expressed that maybe thought it would be good if, I think you guys read the letter that maybe we have some of the public invited to make comments, and I guess that's kind of the board, you know, if they'd like to consider that, maybe inviting specific people who wish to express their opinions on things. But that was the only thing that come to my attention.
Okay, thank you. And I know you contacted her, and I appreciate that. And I was able to return some emails of some other comments. Because of the way we hold these meetings, I continue to feel like the most effective way for us to be able to interact with the public is through this email portal. And I would encourage all of you within your own counties that if comments are received from your county, that you do reach out to them. I hope to get to a time where we can and hold a more formal meeting and be able to have the public with us and join as we did before all of this started. But for this time, we'll continue to try to address everybody's concerns in this fashion. Is there any other comments on this part of the agenda? We'll go ahead and move on then to item 4. Each week we really appreciate representatives from our hospitals being with us in this early meeting to keep us informed of what is going on in each of their facilities. This is why we do what we do, is to support them and to be sure that we keep these hospitalizations at a manageable number so that we can continue on with business and supporting these children and schools as they keep things going. So we will begin with Eastern Idaho Regional Medical Center. I believe we have Mr. Hoffenberg online.
Hello, can you hear me?
Yes, good morning.
Good morning. At ERMAC, we are seeing a bit of an uptick again with our COVID patients. We're back to 22 admissions as of last night. And I'm not aware if we got any more through the night, but over the last about week, we've seen a significant number of admissions back into the hospital. But what we're seeing is a shift back towards a higher acuity. For a while, we saw a number of those patients being purely med-surg, were here for 4 to 6 days and then would go home. But we're seeing a number of patients that are staying in-house for longer. 10 plus days is the average right now. So that is adding a higher level of strain to the system, mostly around, managing where those patients are cohorted, the staffing and PPE, just to make sure that we have those patients properly cared for in the right care setting. We did introduce universal shielding, like I'd mentioned a couple weeks ago. So our staff are shielding whether they're taking care of a COVID patient or not, because we are just seeing such high levels of asymptomatics and we're still not able to test with a PCR confirmation test every single admission. We're trying to do screening for asymptomatics through our antigen testing, but that testing platform isn't foolproof. So we are still shielding anywhere a patient is being seen in an outpatient, inpatient setting to help make sure our staff members are safe and there's no risk for exposure. The rest of the hospital, we are relatively busy. We are seeing a bit more admissions than we were the last couple weeks. So earlier this week, we did hit capacity in terms of just our normal beds. So we are looking to open up some overflow areas for any other patient admissions that we may get if that does seem to be the trend going into the weekend. But otherwise, resource-wise, we are staffed. We have all the PPE we need. Testing supplies are adequate, and we're just kind of seeing what's happening over the next couple weeks. And as we are anticipating some inflow from families and from spread events with children. As I know you all know, we are hearing more and more about exposures and students being quarantined. So that just leads to our concern and seeing if that translates into hospitalizations for young folks or for their family members. So and that's what happened. Is it happening at ERMAC?
All right, thank you. I have one question maybe that I might ask now of you,
Sure.
Mr. Hoffenberg or Dr. Nelson, if you would want to chime in. Is there a reason for the greater acuity, as you say? What causes that? Why is the length of stay going up, or is it just a random situation?
I'm going to let Dr. Nelson also comment. I can't speak to the clinical side I think it's just the type of patients we're seeing. We've gotten a number of patients from outside of Bonneville County, a number of sick patients from Bear Lake County, from Caribou County, and some of the surrounding regions. So, and what we're seeing with those patients is they're just coming in with more comorbidities, and I think it's lending itself to, as we see folks that have other issues, you know, that are contributing to their current state, that they just have been coming in a little bit sicker. But I don't know, Dr. Nelson, you have any thoughts on that?
I think because ERMAC is a regional medical center, they are going to have a higher level of acuity. In our public health reporting, we report members that live in our community. So we need to keep that in mind.
Okay, thank you. Good point. Thank you, Mr. Hoffenberg. We appreciate that report. We'll move on then to Idaho Falls Community Hospital. Mr. Jackman.
Good morning. Thank you for having me.
Good morning.
We are basically going to echo what Mr. Hoffenberg reported. We've seen an uptick in the number of cases and in the acuity as well. We currently have 7 cases. None of them are in the ICU right now. A few of them have been, but none of them had to be placed on a ventilator. We are seeing that they are a little bit more sick. They are requiring more help for breathing, and they are spending a little bit more time with us than they have in the past. With regards to our algorithm tracking our resources, we actually hit our highest point a week ago, and actually achieved the first warning level point in our system. We have 3 warning levels. The first one is more of an informatory warning issue. We have since come down about 28% from there. So we're still in good shape with regards to our resources. We do have 3 employees that are quarantined because of community exposure COVID positive test. And we have, in an effort to try and allow family members to continue to see their loved ones, we have opened up our visitation to allow 1 designated visitor for the duration of that patient's visit. But in order to continue to try and protect our staff, we are asking that when it's appropriate, patient also wear a mask when our staff is caring for the patient. So, that's about where we're at Idaho Falls Community Hospital.
Thank you. Are you two seeing patients from outside of our region, or are you more local? We have 1 that is outside the public health district, and 6 that are from within the district. Okay, thank you.
Mm-hmm.
Are there any other questions from board members? Thank you, Mr. Jackman.
You're welcome.
Jerry, do we have Dr. Gonzalez on?
No, Mr. Chair, she's not able to join us this morning, but she did share some information with me. She said at Madison Memorial, their ICU capacity is currently 50%. They do have 3 COVID inpatients, and 2 of those are in the ICU, and 1 is on the med surg floor. So to me, from her report from last week, that does also show an increase in acuity in the patients that they're seeing there as well.
Okay, thank you. Be sure to thank Dr. Gonzalez from us for getting us that report. So just another question I might have, Dr. Nelson, is this higher acuity, could it be related to the fall? I mean, we were all hearing that they expected an uptick in the fall. Would that have anything to do with it, or again, is it just circumstances come what may?
I don't think we have an answer to that. I think it's just circumstantial at this point. Since flu isn't a reportable disease, we don't have any flu numbers, but the flu shots are starting to be available. And I think the masking, distancing, and hand washing is going to actually really lower our flu season this year.
Okay, thank you. Well, somewhat discouraging to hear a little bit less positive report from our hospitals, but it just shows the continued importance, particularly with these children back in schools, for everyone to be doing everything possible, including all the mitigation factors that Eastern Idaho Public Health asked for. And with this, it will continue to help manage it, but it just really highlights the importance. So we'll go ahead and move on to item 5, an update from Director Rakow. Mr. Corbett.
Thank you, Mr. Chairman. I just want to share a few things with you first, and then I'll turn some time over to James. You can see our number reporting from our health district's website right here. A couple of things I just point out is Bonneville County has dropped to its lowest rate in several weeks at 15.9. And unfortunately, Madison County has achieved its highest rate since the start of our tracking back in July. So we're keeping tabs on both of those counties. I would like to just take you to the Idaho Department of Health and Welfare's Tableau dashboard for coronavirus. It's at the coronavirus.idaho.gov, and they have actually redesigned their dashboard. If you've not taken a look at it yet, it just changed this week, so I'd encourage you to take a look at it. But I wanted to just point out here the laboratory testing. We rely on the state to get the information for the testing for our health district, and we have not received it for this week, and it's not been updated here yet. It's typically updated on Thursdays, so this should change later today. But on the testing information, it does show for several weeks now, going into 6 weeks, it looks like, a downward trend in the demand for testing. The number of tests conducted has slowly declined over the last 6 weeks. This lower chart does show statewide the positivity rate of the tests that are being conducted. Statewide, it's sitting at right at 8%. I think that's what it says. But they have also on this site now broken it down by public health district. So when you look at our health district specifically, it does show a positivity rate of 14.3. You can see that it has come down from a high of nearly 19% back in the 1st of August, and it is slowly coming down. I would maybe explain this by, again, not having a lot of testing for anyone who wants it in our region, that we are recommending that only those that are symptomatic receive testing. And so with that, we would certainly expect that a higher percent would be positive. I will just point out that our health district does have the highest positivity rate at this point in time in the entire state. Are there any questions about that? I know I mentioned last week or in previous weeks that our health district, as well as Southeastern Idaho Health District, is working with Idaho State University and Express Lab to get set up a regional testing facility here in our area. It would be positioned at Idaho Falls Express Lab's location. And with the equipment that is being obtained through ISU, will allow Express Lab to do on-site processing of COVID tests same day or within 24 hours typically. And we expect that within 2 weeks that additional functionality will be up and running. Not at full capacity at first, but hopefully very quickly after the startup that they'll reach that capacity. And will allow for an additional 600 tests a day to be run in our region. We did hear yesterday that BYU Idaho is working with Express Labs to actually establish a collection site in the Upper Valley that will again provide more access to people in our region. So we'll keep you updated on that, but that is a very positive positive thing that's happening on the testing front. I'm going to now.
Jerry, I have a question.
Yes, Dr. Nelson, go ahead.
Some businesses in the region allowing their employees to return to work if they have a negative test. So I know we are testing some asymptomatic people. Concern is, since there's up to 14 days after
Dr. Nelson, I'm sorry, but you're cutting out.
having some
Only-
false negative.
I'm only catching about every third or fourth word.
Okay, can you hear me?
Yes.
I'm just concerned that some of the businesses that are allowing people to return to work if they have a negative test after exposure, if they're returning to work or getting tested too early in the window, there might be a lot of false negatives for people that later become symptomatic. Have you heard of that guideline?
Certainly we have heard of that. And I will just say that the guidance that comes down from the CDC and that we recommend through Eastern Idaho Public Health is that regardless of one's test, if they have been a close contact of have an exposure and they're considered a close contact, that they are asked to isolate for 14 days. A negative test during that time does not release them from isolation. And that is because the incubation period is up to 14 days. And at any time during those 14 days, they could convert to positive. We do know that there's, majority of people become symptomatic around day 5, but that does, even a negative test at day 5 does not release them. We also do know that some businesses, and through their own policies, and it's different from business to businesses. I know our hospitals have different policies just because of the very nature of their need with the healthcare professionals. But the CDC guidance is that a negative test does not release one from isolation. Do you have anything to add?
Okay.
Okay.
Yeah, thank you. I did hear that from an ERMAC physician saying that the physicians exposed were allowed to go back if they tested negative at day 5.
And that would just be an individual hospital policy. It's not the CDC guidance specifically. And there is a list, early on when we had the stay home order and the list of the essential businesses, CDC does have guidance that does allow different things to be done for essential businesses. We at Public Health do not deem which business is essential. Many are making that designation themselves. We certainly do provide them guidance. There are additional precautions that should be taken with any employee that returns to work during the 14-day isolation period. But that's not a decision that Public Health is making on their behalf.
Okay, can I ask one more question?
Of course.
Go ahead.
Have we heard, I've heard of asymptomatic people being tested prior to travel and having requirements to go to other places.
Mhm.
This might be a question for James, but what's the estimates of our turnaround times on testing now?
I can show you, give me just 1 second, I can pull up our dashboard. We incorporated on our dashboard the testing turnaround time for the past week. You can find it here on the overview page, right here. So the average test turnaround time is 3 days. That does include the labs that are being sent out to, the samples that are being sent to the national reference labs, as well as the rapid tests that are, done on site and come back typically within an hour.
Okay, thank you.
And I do know that it has been a struggle for some people that need to have those tests done for travel or other requirements. There's not a lot of options for people to actually receive those tests in our area.
Okay, is there any other questions from board members for either Jerry or James? Okay, anything else you want to add?
I'd like to just turn some time over to James to look through our specific response plan metrics.
We can certainly dig into the details of certain counties that are on the agenda for today. Certainly there was, we have, it's just going up. Here's our overview page with number of individuals, 3,155 total cases currently, with 293 active cases and 15 recorded deaths. As we talked last week, deaths in the last few weeks have increased, and you know, we want to continue to monitor that as a and how that is going, certainly with the hospitals as well. So on the response plan case and rates here, this is again, we'll go over total, the rate for each county at the top, and then each individual county has a metric. As Jerry mentioned, you can see Bonneville's at 15.9 is one. It's trended down in the last week, and we're happy to see that. Clark County very variable, but go ahead to really, we can go to Custer County did have a peak where we have not seen a case for a few days now. We'll continue to monitor that, but that spike in cases coming last week, at least for the moment. Fremont County is seeing a slight increase, you know, with Labor Day activities and them being a destination, as they've said before. We are concerned about that in an ongoing manner, just to see if there's increased cases that come of that. Jefferson County has decreased, and to a current point, they did start slightly increasing here just this last few days. We'll continue to monitor that. There was, I'll just say that we did not receive very many lab reports on Monday on Labor Day, whether that was due to a break in testing for individuals that had gone away for the weekend, or whether the National Reference Labs just did not receive as many. Monday we had only 12 cases reported, which is quite a drop from our normal, you know, around 40. So it does play with the numbers just a little bit as that gets ironed out. Lemhi has continued to decrease and stay fairly flat. Now, Madison County, we talked about this last week, that they were seeing a slight increase. That continues to happen with their first day over 10 in quite some time, with a rate of 12. You can kind of see by this incident graph or bars that they are seeing a fair number of cases coming in the last few weeks, more than they have seen in a while. Teton County again continues to drop with low, really, and kind of sporadic incidents of cases. Right now, 4.1, as you can see. And overall for the district, we're staying fairly steady on our incident, as some counties go up and some counties go down. But really, our peak right now for the district has been kind of the first few weeks in August for both incident cases as well as that active average rate. You can see there's been a few different days that we've had a few lower numbers from. One being a Sunday, 10 days ago, and then again on Labor Day as well. So, healthcare have stayed steady the last few weeks at the ICU occupancy. Again, this is not just COVID, but overall ICU occupancy. You can see maybe that slight uptick just recently here to maybe confirm and show what the healthcare entities reported earlier today. Overall capacity at the hospital is continued to be fairly steady, with some ups and downs. Certainly some variability on the weekends as some of that capacity is not utilized. We are seeing a slight increase just again the last few days. And then the percent positivity Jerry showed you, we do have it at the bottom of this page, but again, the last date that the state is reporting and has sent to us is the 29th, which was at 16%. We are interested to see where that will trend down, when we receive this next data from them.
Are there any questions about any of the data or the metrics?
Mr. Chairman,
Go ahead, Commissioner Miller.
I just, a question, I guess, for Bill. Is people mostly voluntarily masking up in Teton County still?
Go ahead, Bill.
Okay, can you hear me?
Yes.
In Teton County, what we've seen is that since school started, we've noted that at the local grocery store, that a lot of the high school kids that go there for lunch are not wearing their mask. Overall, when I've been around out in the community, people are wearing them, and very few instances I've seen people not doing it. I've noticed on the playgrounds or at the sports activities, they're not necessarily wearing them religiously. But we've been under a mandatory mask order in the city of Driggs and Victor for probably 2 months or more.
It's around
And-
July 4th.
Yeah, since July 4th. And what I'm hearing from people is that there's not a big outcry of people opposed to the mandatory mask thing. There's a few people that don't like it, but all in all, people are very supportive of it. And I think our numbers are showing that over time where they've come down significantly. We started school last week. And I think what I've seen there, because I pick up a 6-year-old occasionally, is all the elementary kids at that school and the staff, I've seen nobody without a mask. The kids come out of school, they all got their mask on, and they don't take them off till they get pretty good ways from school. So what I'd say, Lee, is that in Teton County, everybody understands the importance of keeping this under control. And it's not just about the hospitals. It's really about keeping the kids in school, because I've talked to lots of parents and they're ecstatic about having their kids in school and getting back to a more normal, even though the mask wearing is not normal for them. The kids don't seem to be too concerned with it. I am concerned that at the high school level, that some of the kids showing up at businesses and the business is not encouraging them to wear a mask. It's kind of disappointing, but overall, I think it's where we want to stay the course where we are, for sure.
Well, I appreciate that, because it shows by the numbers, and I kind of go by what's going on in Teton County for Fremont County, because there for quite a while there's real correlation to that, and I've noticed your numbers have just been staying down. Of course, we get a huge influx of people up here. So thank you.
Mr. Chairman, I would just also share that I presented to the Victor City Council last evening, and they did extend their mask ordinance until it's rescinded. So that will stay in place for the time being.
Okay, thank you. Are there other questions?
Yeah, Mr. Chairman, this is Commissioner Young. I was just wondering, Madison County's kind of been unique in that they've stayed low, and now it looks like we've got an uptick. I was just wondering, I haven't looked at the data, but from the data, James, is it a younger population that's being affected in Madison County, or what's going on there? Do you know?
I looked at that this morning, honestly, because the Madison County Emergency Manager reached out to me last night when we had that large increase in cases. I'm just gonna, if you can see here on the detailed case information, you can sort by county. So I'm doing that for Madison County to pull that up. It'll take a minute here, I'm sure. And as I was looking at it this morning, it certainly is a variety of ages. We do see that there's, you know, some younger kids that appear to be household members, but it is not one specific age group. Trying to get to the bottom here. There we go. So if you look at Madison, you know, 50s, 20s, children, 20s, 30s, 40s. So it's across the board.
Are there other questions?
There is one from Madison County, if I might, Mr. Chairman.
Go ahead.
I don't know what to think of the information in the data. When we go from 27 to 48 in the space of 5 or 6 days, I don't know if it's testing. I can tell you there are more 2F and 1T and 8B plates in Madison County than there are 1M. And it could be because of the less restrictions. I know in our shopping and in our location, in our activities and that kind of thing, and we may be seeing the product of that. But to have an influx of that many cases in that short of time, I do want it on the record. BYU Idaho has not started yet. And so I'm hoping that there will not be fingers pointed at the return of students. Now, if it goes to 150 next week, perhaps we can make that correlation. But it's unexplained. I've heard Dr. Nelson say many times, we don't know right now. And I do not know what that is. I'm watching with very keen interest in the next 3 or 4 days, and Madison will be a beacon. If we drop back down to 30, we're going to have to take a look at how reporting or something. I don't know. We have been so low, and then all of a sudden to jump. And if we stay, we'll know that it has finally caught up with us. But if we drop back down, we've got to take a look and see what we're doing here, because it impacts all counties, all surrounding us. It really does.
Jerry or James, thoughts on that?
This is James. I would just say that certainly we're keeping a close eye on it. We've talked many times, even in this forum, about why the Madison had such a low rate. Certainly, we report cases as we receive them. So there's nothing that we have done to necessarily hold numbers. I don't know necessarily, because we don't receive all of the results. So I can't tell you with 100% certainty that there's been increased testing. I can just say that normally with increased testing, increased ill individuals are present, because for the most part, there are some symptomatic testing going, or asymptomatic testing going on. But for the most part, really, providers are just testing symptomatic individuals. So it would include, as if we increase in numbers, that there are more sick individuals. Whether that correlates to schools opening, that could be potentially happening, as well as increased activity where maybe Madison County residents were going out and not necessarily inside their own city. Maybe as things are increasing, maybe more people are staying home a little more often and circulating within their own county potentially, or as Commissioner Mendenhall mentioned, maybe individuals coming from other counties are helping to increase that. we've always had cases within Madison County, so the potential has always been there to have an increase. I appreciate him noting that it's, the students are not back yet. We do not attribute this to BYU Idaho. It really is within the community and has a potential to increase at every time. We saw that in Bonneville County or earlier this summer as well, where we were sitting at the active rate of 5 or 6, and then within a few days, really, it had increased to above 10 quite rapidly. And that exponential growth that is possible can catch up with different locales at different times.
Thank you, James. Are there other questions? All right, we'll go ahead and move on to item 6 on the agenda. The good news is we have seen counties that have come down, and you know, counties where there has been actions taken, and fortunately their numbers have decreased to a point to where they have fallen below the rate for the moderate risk down to the low risk. So Jerry, would you explain to us where we're at on that?
Yes, the first order for consideration is that for lifting the restrictions in Teton County. Their order went into place on July 16th. On August 3rd, 6th, sorry, the days are kind of jumbled in my head, but I believe on August 6th, the board had considered lifting the restrictions in Teton County, not effective until August 10th. When August 10th rolled around, they had bumped back up, and so the restrictions were never lifted in that county, and they continued on until today. Teton County has now been under the rate of 10 per 10,000 for 11 consecutive days. And so according to our plan, they are eligible to have the order of restriction lifted for their county. I will say that visiting with the Victor City Council last night again, there certainly is concern being voiced that with schools just starting back up, there's certainly the opportunity for cases to increase. And we are continuing to watch that. But at this point in time, I put before you the draft order lifting restrictions for Teton County that I propose be effective immediately.
Okay, let's go ahead and discuss this one. We'll do one at a time here. So comments, questions, thoughts? Go ahead, Bill.
Commissioner Reed, this is Bill Lake from Teton County. As I said earlier, there's no desire amongst, by sure, a majority of the communities to leave the mask order, face mask order in place. Like I said, we just started schools. We need to give that at least another couple of weeks or at least a week to see how that pans out. We're just coming off a Labor Day weekend. People I know went out and traveled or coming back in. And with this 14-day incubation period, I think that it's in our best interest and the desires of the local community overall to keep the order in place and not lose ground while we've had such a great opportunity here to gain ground. So I would encourage my other board members to, if a motion's made, to not approve lifting the order. Thank you.
Okay, is there other comments?
Mr. Chairman, if I might.
Go ahead.
I can't argue against the numbers, and I think Mr. Lake is right that they have seen a great progress there. What I am proposing is that if we do not lift this order, we need to revamp our plan. There are not maybe as many, I don't even know the number of division of those who are opposed to mandatory orders as there are who appreciate them and see which way they go. But we have a plan in place. So I am moving from the scientific arena of perhaps results to what this board has put in place. And if we are addressing the public, we're not addressing those who make the most noise or those who have the greatest desire, we have a plan in place. And so if we do not restrict this, now I'm talking about processing and I'm talking about following a plan that we established. If we do not lift this according to our plan, we need to revamp our plan. Otherwise, we are denying the insights of some, and I'm not comfortable with that. We either follow our plan or we revamp our plan, is where I'm going.
Chairman Reed?
Go ahead, Dr. Nelson.
Just a question for Jerry. Doesn't our plan give us the flexibility to not rigidly follow those guidelines?
Everything certainly within the plan is at the discretion of the board. It does not specifically address whether or not we lift the orders or not. It just says our guidelines will be after 7 consecutive days below the metric that it's eligible for the restriction being lifted.
Mr. Chair, I'd like to comment to that.
Go ahead.
The last time we had this come up, we had a pretty extensive conversation that the number is set there, but it's not set in stone. It's a guideline. We have lots of criterion that says that we can consider lifting the order. And that's what we're doing here. We're following the plan because we're considering it. And I just gave all the logic I could come up with as to why we should consider not to lift it. So I appreciate Brent's comments, but we are following the plan. We made the plan so that it's flexible for each county's individual situations. If you look at Clark County, for example. So I guess I would disagree. We are following the plan and we have that flexibility to do what we think is best for that community. If we're just going to use the number every time, then we probably need to go change the plan and say, disregard all that flexibility. We're just going to go with a hard, fast number, which I would totally disagree with. So I think we are following the plan, and I think that we went to great strides to put all that flexibility in there to consider these things, and that's what we're doing. So that's my comment. Thank you.
Okay, thanks.
I agree with Bill. I think the way it's written, it's flexible enough that we don't have to, it's not black and white at this point.
Okay, thank you, Dr. Nelson. The one comment that I might make is there already is the mandates in place from Victor and Driggs, and cities or counties have within their right the ability to more specifically tailor it to their area. I do have some concern. I agree with Commissioner Mendenhall that, you know, we have to remember the people that are not in the room as well. And there are those that are watching it that would like to see us follow it with the number, that would like to see it restricted. Nothing that we do forbids people from continuing to do everything that they are already doing under the mandate, but doing it under their own free will. And hopefully people would see the wisdom and see what has been accomplished from it and would continue it. There comes a time when people have to be expected and have the right to make the right decision on their own without being compelled to. And so I think we have to be respectful of that as well. That would be my comment. Other board members?
Yeah, this is Commissioner Young. I'd like to reiterate what Commissioner Mendenhall said. I agree that if we're not going to follow, we have the numbers for a reason. And otherwise, you know, I guess we just should forget the numbers and then make decisions on a weekly basis, whether we follow it or not. But the plan needs to be revamped if we're not going to follow the numbers. And if we're going to change the plan, it is flexible, but then it needs to be on the agenda for an action item so that we can do that. I understand, and I am a little bit worried about, Teton, Jefferson County, et cetera, some of these counties that are coming under. am worried about that. Perhaps maybe 7 days is not enough time, because we could take these, especially with school going, we could end up taking the order off this week, and next week we may have to reinstate it. So that I do worry about that perhaps we need to look at our plan and consider some changes. But for now, I this is what we have, and like I say, it's, our plan is set up, not necessarily, okay, the mandate may come off, Teton, but we still encourage everybody to wear the masks and to promote that. So I agree with Chairman Reed that we need to be respectful of those things also. That's all.
Chairman Reed, Bill Lake again.
Go ahead, Bill.
So I just gave an example earlier where the high school kids are showing up at Brolam's not wearing masks. I agree with you that people should do what's right. Unfortunately, in our society, there's a significant number, small vocal minority that is just not going to do the right thing. And it's unfortunate we have to have those people, and that drives us to have to do these kind of things, to have a mandatory mask order. But that's we have all kinds of rules and regulations out there because people have chosen not to do the right things. And we're here to protect the people that are doing the right things, and that's what we ought to be considering and concerned about. If people want to protest mask orders and things like that, that's a whole nother discussion someplace. But right now, our job in public health is to protect the individual citizens in our communities from those who choose not to do the right things. And that's the position we are in Teton County. And I got to tell you, keeping these kids in schools has got to be the most important thing that we think about right now, far beyond what anybody thinks is a burden on them to wear their mask. Because if we have to shut down the schools, it's going to be catastrophic to keeping our businesses open, because parents won't be able to go to work. They're going to be teaching their kids. So we're looking good here, and we want to stay there. So if we want to change the plan, I'm all for revisiting that at another meeting. But for now, the plan gives us that flexibility to not stringently follow some numbers that we came up with that have no long-term basis. We came up with them based on the best information we had, but certainly not from years or months of data that would say, this number is definitive. This is what you need to do when you hit this number. So that'll be my last comment. I appreciate you listening to me. Thank you.
No, we appreciate your argument. You make great points and you articulate them well. So we appreciate you being on our board. Are there any?
Mr. Chairman, yes,
ahead,
there are. Bill, I've got to ask you, I'm trying to connect all of what you're telling me, and I understand it's not about, for me, it's not about the numbers. But you have a mandatory mask order in place now. And taking into account Commissioner Reed's comments about at some time people have to take responsibility for themselves. The Eastern Idaho Public Health Board can't, sorry if I cut out. Eastern Idaho Public Health Board can't be the regulatory agency that comes in and says you will wear a mask. You have a mandatory mask order in place now, and you tell us that the high school kids are not following that. I've lost a little bit there. If we remove this order now and the city of Driggs and the city of Victor keep their mandatory because of a local, in our plan, it says local officials can do things more restrictive. What's going to change? I'm seeing those high school students. It's not about a mask order. It's not about numbers. It's about what's happening in Madison County, what's happening in Teton County, who's teaching who's saying, hey, when you go to school today, high school student, you wear your mask. And I'm not comfortable that if we have a metric in place and we have said, when we reach this metric, it's accomplished what we wanted it to. Now you take it from here, people, and you go on. And so I'm a little lost of I would love to see the mask order stay in place where Teton County is comfortable with that. I'm looking at Madison County coming up to a potential mask order, and there are going to be people who want that lifted just as quickly as it can be lifted. And I'm not sure when we flatten the curve. I'm not sure when Teton County has said enough was enough. We've taken it in our own hands and we've flattened our own curve. Now let us live. So I don't know if it's about this order. I'm just not comfortable when I hear one hand, we've reduced the numbers, and on the other hand, we have a group of students or whoever not participating in this order. And so I'm getting more and more confused as the day goes on. I'm still not comfortable that we keep the order in when we have told public in general, you get below our metric, public health metric, and we'll take it off and you take care of business.
Go ahead, Bill.
Thank you, Mr. Chair. And Brent, and here's the issue is we don't have any enforcement going on this. I would like to see Brolum's have somebody stand at the door and say, hey, we are under a mandatory mask order. Please put your mask on. We know the sheriff has said he's not going to enforce it. Okay, well, there's lots of laws out there that aren't enforced, so that's not anything new. Okay, but the bottom line is somebody, and I don't know who's letting those high school kids get away with it. You know, I would like to see the principal tell them, hey, you guys, if you go out for lunch, be respectful of the businesses that you're going into and your fellow human beings out there and do the right thing. If people continue not to do it, you know, we're not gonna win that battle.
No, I agree.
Okay.
I'm with you. I agree.
But unfortunately, we haven't had the opportunity. We're going through this now. The next pandemic, God forbid, we'll have a better idea of how to address all these kind of issues. But in the meantime, we need to do what makes sense. And we've heard that a lot from people is, why can't we just run government by doing what makes sense? And that's what I'm trying to do here in Teton County, when I know that what makes sense is to keep people wearing masks, and anything we can do to promote and, encourage that is the best thing for our community. I think a lot of this conversation we're having after this pandemic goes through, we need to come back and revisit it. And maybe the legislature will visit it for us here coming in January. But until then, we have to do what we think is best right now, based on the information we have. And the information we have is, let's keep people wearing masks, at least in Teton County, because we know things are working good, and we don't need to do this gyration where we take it on and put it back on. It's there. So that's the best argument I can make, Brent. Thank you.
I'm ready for a motion if it is the desire of the board to make a motion on this. If it stays in place, we don't need a motion. To rescind it, we would.
Mr. Chair, can I have one more thing to this, please? This is
Go ahead.
And I'm totally respectful of Bill and what he's fighting for in his area, but the East Idaho Public Health, Jerry and her staff have done such a wonderful job, and we put together these metrics to follow and have guidelines, and it is not an exact science, but it's been proving out that she's put some pretty good numbers in place where things are working. And East Idaho Public Health represents 8 counties and not just one particular one. And the fact that Driggs and Victor have put in place their own mandated mask orders, I think East Idaho Public Health would lose credibility if we didn't follow what we're doing. We haven't made any changes. If we need to make changes, that's that one thing. But where we're at now in today's world, if we don't follow our metrics, I think we lose all the credibility that we've earned from the public, because they're starting to trust us. They're starting to trust what we've put in place and what Jerry and her staff have done. So that's just my comment.
Okay, thank you. It has been obvious that it has worked, and I would agree with you. Their numbers have been good. It has proven out to be as they expected in regards to hospitalizations and everything else. So they have done a great job. Is there any other discussion? Is there a motion, or is it the desire to move on?
Mr. Chairman, this is Commissioner Shenton, I make a motion that we follow our plan and put Teton back to the green.
Okay, we have a motion.
I'll second that.
I heard a second from Commissioner Miller and Commissioner Minor. So there is a motion and a second. Discussion on the motion. Hearing none, I'm going to ask for a roll call vote on this. We'll start with Jefferson County,
Yes.
Madison County,
Yes.
Fremont County,
Yes.
Teton County,
No.
our physician, Dr. Nelson,
No.
Lemhi County,
Yes.
Clark County.
Yes.
Okay, the motion passes. So we'll go ahead and ask Jerry to go ahead and rescind the order. And I want to go back and thank you, Bill, for the way you represent your people up there in your position. You do it in a respectful and a logical way. And I appreciate that. And I hope that the people will take the responsibility and make the right choices, see what has been done. I do believe that there is times when people need to make the right decision on their own. And so I hope that will happen. And we do hope the best, because I think you said one of the most important things is one of the greatest things right now is to keep these schools open and going. It is so important for the community, it's so important for these children. And I think all of us are spending a lot of time in great hope and in prayer that these schools will be able to handle the cases that will come to them, and that the numbers stay small enough that they can keep going. So thank you for a good discussion on that. Jerry, you have on the agenda for Jefferson County.
Yes, Mr. Chair, thank you. And Jefferson County has not yet met the 7-day metric for being underneath the rate of 10 per 10,000. I pulled up on the screen the case counts for Jefferson County. You could see since last week they were trending downward. However, the last 2 days they have ticked up again. They hit a low of 7.7, and now we're about 7.4. It looks like on the 7th, and as of yesterday they're at 8.7. So while they were trending downward, the last 2 days they're trending upward. In the past, we have done action that would be effective at a time certain. And so in this situation, if the board wanted to consider assuming that the county stayed under that 10 per 10,000 metric for the next 2 days, that would be the 7 consecutive days. Consider lifting the order on September 12th, which would be Saturday. Also, we have, as we did with Teton County, they had not met the 7-day metric as of last week, and so we just let that ride until this week's board meeting when they had fully completed that 7 days. I'll turn it to the board for for your discussion on Jefferson County specifically.
Okay, so this is a different circumstance. They have not been there. Teton County had been there for 11 days and Jefferson County is not there. It's not unprecedented that if we would set it for a future date, we've done that in other counties, but we have also waited.
Right.
So, discussion from the board, especially with school starting up, what would be the best option here? It certainly could be considered next week when they will be past the 7 days. Hopefully, if their numbers turn back down and they stay under it. But comments, Commissioner Young.
Yeah, here again, I think we should be following the plan. And I know there's a lot of residents in Jefferson County that do not like the mask mandate, but some still wear it. My understanding is the positive on this is that our schools in Jefferson County are doing a good job of having students wear the mask and they're distancing. And I think maybe the rates are showing that. I don't believe there's been any outbreak in our schools because I got to give credit to our superintendents and school board that they've been doing a good job there. And you know, it's kind of this mask mandate, at least from what I'm seeing in Jefferson County, that it looks like people either believe it in or they don't. And I'm not sure the mask mandate is making that big a difference here. Some stores, I give them credit. There are some stores that are being a little more progressive in helping people wear the mask, but I'm not so sure that maybe our downtick in cases here in Jefferson County may be just because summer coming to an end and people not gathering in social gatherings as much, or you know, at our Jefferson Lake. And but anyway, I feel the same way, that we follow the plan, and I am very worried that we may return to above our 10 per 10,000 soon, possibly even by next week. But if that happens, maybe we need to revisit the plan, as Commissioner Mendenhall pointed out, and maybe instead of being 7 days, maybe it needs to be 14 days or 30 days. But those are my thoughts this morning.
Okay, is there other discussion? I would add that I agree with you about how well the schools are doing. I've watched the schools in Bonneville County as well, and I really applaud them for taking all the measures they're taking. There was so much concern about students and wearing a face covering at school, but not unusual that young people quite often show us how they can do things better than adults sometimes, and they've just accepted it, and they do it so well. And I hear from my grandchildren that, you know, it doesn't seem to be a problem. Even the young ones, they wear it all day, and they said it doesn't bother them. And I applaud the schools like you for taking the measures they've taken. It's interesting when it comes right down to how important it is. The schools have said, no, we realize that the masks, the face coverings do help, and we need to do everything we can to help this work. And so the schools are requiring it and asking for it. And so, you know, isn't that a good example, and kind of what we've been saying all along? That's what we're trying to do, is everything we can to keep life and business and schools going. And the schools are following that same plan because they know, they can see that the effectiveness, they've looked at the science, they know it works. And so everybody does all we can. So I'm sorry to get off topic, but I agree with your comment about the schools, and I applaud the ones around here as well. Other comments? They do have this order in place that it would be lifted on September 12th. If they continue under it for that time. So again, it would take a motion to do that, or we can wait till next week and see where they're at. Just what's the other thoughts from board members?
Mr. Chairman.
Go ahead, Commissioner Mendenhall.
Thank you. Jerry has the order, of course, in front of us here, and it has become effective September 12th. Do we have an escape clause that if Jefferson or Teton, let's see, Teton's was effective immediately, was it?
Yeah, because they had already been in.
Right, okay.
More than
But
seven.
say, for example, Jefferson County, September 12th, that's still 2 days away. If they jump back up and meet that 3-day, well, they wouldn't make it by the 12th.
Mr. Chairman.
Go ahead.
Just to clarify for Commissioner Mendenhall, if they jump above the 10 rate, they're not eligible for lifting the order. It has to be 7 consecutive days under the rate. On the other hand, Teton County, to go back in, they would now need 3 days over that rate. But
Okay.
Jefferson has to have 7 consecutive under. So 1 day, tonight or tomorrow, if it were to jump above 10, they would be ineligible for lifting the order.
Okay, I just, when I was looking at this, I didn't want the order to be official.
Yeah.
Regardless of what comes, it will end on the 12th. So I'm glad we have that out.
Yes,
Okay.
so if there is a motion, I would certainly ask that it include language to say as long as they remain under the metric for 7 consecutive days.
Thank you.
I think it is not unreasonable to table it until next week, given we've just gone through Labor Day weekend and the school opening.
Okay, I appreciate that, Dr. Nelson, and there may be some wisdom in that since they're not under now. I mean, rather than doing it at a future date, but I would defer to the board. So hearing no other discussion, I will either ask for a motion or we're going to move past this.
This is Commissioner Young. I would like to make a motion that the order be rescinded in Jefferson County on September 12th, provided that they stay under the 10 per 10,000 metric that the health board has set.
Okay, there's a motion. Is there a second?
I second.
And there is a second by Commissioner Minor. Discussion? Okay, hearing none, we'll go ahead and do a roll call vote again. Jefferson County,
Yes.
Madison County,
Yes.
Fremont County,
Yes.
Teton County,
No.
Dr. Nelson, Dr. Nelson.
Sorry, I got kicked out of the meeting. I didn't hear that.
So there was a motion made by Commissioner Young that the order be rescinded on September 12th as long as they continue and they have fulfilled their 7 days under. There was a
Okay, I oppose.
by Commissioner Minor. Okay. Lemhi County,
Yes.
Clark County.
Yes.
Okay, that motion passes as well. So to clarify, this motion will not be valid. It will vanish if if Jefferson County does not remain under the metric for the next 2 days.
Mr. Chairman, we won't know that for certain until probably 6 p.m. on Friday.
Okay, so then it wouldn't go into effect until Saturday morning, right? You would go ahead and.
Correct. And I will
Okay.
communicate with the board one way or the other. If in fact they stay under the metric, I would send the order out and notify the press at that time as well, Friday evening.
Okay. And yeah, this does concern me. I think there were some great points with the Labor Day weekend and school. So We will hope that it continues to go well in Jefferson County. We would encourage everyone to continue to do those measures that help mitigate the spread, including hand washing, hygiene, social distancing, staying home when you're sick. I think it's one of the most important. Just to please stay home if you have any symptoms or if you're not feeling well at all. And of course, face coverings are proven to help and are one of the measures that will. So thank you, board members. That comes to the end of our agenda.
Mr. Chairman,
Go
Mr.
ahead,
Chairman,
Commissioner Mendenhall.
I'm not sure of the restrictions on our agenda items, but a non-agenda item we have to take a look at is Madison County. In 2 days, we could be facing the necessity for an order according to our COVID plan. If we maintain that high number and being at 48, that's quite a few above our metric of 40. And I don't know how a non-agenda item works. Jerry, you might have to help us here, but just as much as we take these people off, we need to put counties off, we need to put counties on. And I'm sure I'm not going to be Mr. Popular in Madison County for even suggesting this, but that's a consideration that within 2 days, we could have the need for an order for Madison County.
And we are not going to be able to consider that today. We did not amend our agenda, which would have been required. And per the open meeting laws.
You're saying I'm too late and too slow, right?
We would have had to amend this agenda.
Okay.
And
It didn't hit me until we had these discussions with Bill and Shane. So sorry about that.
so no, I appreciate your thoughts, Commissioner. One thing we can do, so we typically meet on a Thursday. If we see that number proceed higher over the weekend, we can call a special meeting with just a 24-hour notice.
Okay.
Jerry?
Yes, Mr. Chair. If we see that for 3 consecutive days, that would be Saturday evening. And if it's the pleasure of the board, we could notice a meeting for Monday to take action on Madison County if you would like.
Would you recommend that, Commissioner Mendenhall?
I would. Please note, general public or whoever is listening, I am in no anxious mode or in any hurry to have an order placed on Madison County whatsoever. But we have seen these orders be effective, and I'm looking out for the welfare of Madison County.
Okay, so Jerry, we would ask you to do that. If that continues, we'll go ahead and post a meeting for Monday.
May I ask what time would work best for the board members? We could do a noon time or 5:30 p.m. meeting.
Well, that's our main commissioner meeting day, I think. So for everybody, but we usually go from 8 to 6 or 7.
So would you want to do 7 a.m.?
I think that'd be best to clear the day.
Okay.
Yeah, 7 best for me.
Okay, thank you.
And if we do that, most likely it will replace our meeting for next week. We would not then need to meet on Thursday. I know it takes a considerable amount of time from all the board members and our staff. But I appreciate your desire, Commissioner Mendenhall, to look out for the benefit of the county in Madison County. And there's a lot going on up there because school will be starting next week, and it's important for them to be able to have a safe environment.
Mr. Chair, would it
Go
be
ahead,
possible
Commissioner
to
Minor.
move that to Tuesday morning at 7 a.m.? Don't we need the 24 hours of working day, or can it be called anytime, Jerry? I'm not sure how that works.
I can't say that with certainty. I just know it's 24-hour notice. I would need to go back and read the statute if that requires a 24-hour business day.
I don't think it is, but you may be right, Commissioner Minor. I would recommend, Jerry, that you go ahead and post the meeting for Monday morning. It can always be canceled. but we go ahead and post it with that agenda item. And if we see them fall back below, then we'll just simply cancel it, email the board members, and note that on our website. Is that doable?
Yes.
Okay. That way we will meet the obligations and still be able to do it Monday morning. Any other comments? Thank you, board members. I appreciate each and every one of you, and again, can't ever say enough about the extraordinary work from Eastern Idaho Public Health. So we'll go ahead and call this meeting to a close. Thank you. Have a good day.
Hey,
Thank
thanks,
you all.
everybody.
Thank you all.